Well, good morning. Thanks very much for joining us for our next session. A health service to be proud of, Labour's vision for the NHS and care. I know the last session ran over, so we'll get cracking. My name's Patrick Maguire. I'm a political reporter and columnist at The Times. Also wrote a book about Jeremy Corbyn, which some of you may have read and had nightmares about. Obviously joined this morning by a man to my left. Not often you hear that about Wes.
It's outrageous.
who requires no introduction. The Shadow Secretary for Health and Social Care, of course, and MP for Ilford North. Dr. Zubir Ahmed joins me as well. He's the prospective parliamentary candidate for Glasgow South West and is a transplant surgeon serving Glasgow, Pollock and the west of Scotland. And down the line we're joined by Charlotte Augst. She's a health expert, chief executive of National Voices, formerly leader of the Richmond Group for 5 years, developing strategy and held senior positions in health and research policy. And Bibby, the director of health at the Health Foundation. She's responsible for leading the foundation's Healthy Life strategy to create the opportunities for everyone to lead a healthy life. So without further ado, I'm going to get each of the panellists to give you their spiel for 3 to 4 minutes on that big question. What should Labour's vision for the NHS and care be? Under the Tories, Britain's health and health service have been allowed to decline, long waiting times, stalling and even falling life expectancy and regular strikes. What, if anything, is the solution a Labour government coming to power in difficult circumstances can do with that one? So I think I'll start with Bibby first. Jo.
Hello, good morning. So I'm the Director of Health at the Health Foundation, and we're an independent charity engaging across the political spectrum. So we're really pleased to see Labour engaging in the prevention agenda. Everyone can see the NHS is under strain, whether it's the workforce challenges, the long waiting times, or the gaps in services. But if we really want to fix the nation's health, we need policies that look beyond the NHS and social care. For us, a prevention agenda means doing more to keep people healthy in the first place. It means putting in place the building blocks of good health, by which we mean an adequate income, good quality work and housing, strong families and communities. But over the years, the prevention agenda is too often seen as important but not urgent. So action and investment continues to be directed towards fixing illness rather than investing in keeping people healthy in the first place. So we've been arguing for a step change in how we think about health. We want health to be viewed as an asset worthy of investment, not just for people as individuals, but for society as a whole. And there's 3 reasons why this makes sense. First, good health supports the economy. It boosts productivity, it helps people stay in work, which means people are paying taxes and creating much needed revenue for the Exchequer. Health Foundation analysis has found that the underlying ill health is now the main reason for the rise in older workers being out of the labour market. And around 1 in 6 of the working age population now report themselves to be long-term sick. Second, good health is a social justice issue. Health Foundation analysis shows that a 60-year-old woman in England's poorest areas typically has the same level of illness as a 76-year-old woman in the richest areas. That's a 16-year health gap. And finally, good health is a political issue. When asked, people cite good health as the thing they most value. And research that we conducted in partnership with Public First finds that worsening health inequalities loses votes, while preventative health policies are vote winners. So what could a Labour government do? Critically, we think it needs to see people's health as a cross-government responsibility, not just a responsibility for the NHS. There needs to be legislation that secures long-term action. As IPPR has suggested, we can learn from the approach taken to tackling climate change, for instance, by creating a Health and Prosperity Act, modelled on the 2008 Climate Act. But Labour will need to answer 3 challenging questions. First, given Labour's fiscal rules, how will you address this without new money? Second, how will you avoid being cast as anti-business, given that this will inevitably mean more regulation? And third, given the action needed on risk factors, how will you deal with the accusation of the nanny state? So we think one way will be for Labour to start building alliances now. You need to get progressive businesses on your side, as well as making the case that for most businesses, this is in their interest. The time is right for this, when so many businesses are seeing that the costs of ill health are a very real challenge to their own bottom lines. In the past, Labour challenged big tobacco, and the smoking ban in public places saved many lives. But if you want a healthy, growing economy, you need to apply the same thing to big food, to big gambling, to big booze, and to exploitative employers. The truth is that a few bad businesses are adding to costs for the majority who want to do the right thing and are vital for economic prosperity. So we think, ultimately, fixing the country's health isn't just part of the health mission. It isn't just the responsibility of the NHS. It's a whole government challenge and should be core to Labour's economic mission as well. So thank you.
Thank you. Thank you very much to Joe Bibby. Zubir Ahmed, obviously you have a unique perspective as a working doctor as well as an active Labour candidate. What do you think?
So thank you very much for asking me to be here, and I can thank my local party for giving me permission to come on a Saturday, and I've promised them a good door-knocking session tomorrow to make up for it, and as I always like to check with Wes just to make sure he knows I'm working hard, just in case he thinks I'm just here doing the exciting parts of the job. So the concept of the NHS, I think, is still a beacon to the world, but the current NHS is no longer the best health service in the world, and that's really difficult for me to say as someone who's been in the health service for over 20 years. And we all know not only money is going to fix this problem, there's going to have to be some structural change. And when we propose that concept, we come up against a couple of recurring accusations. One of them is that we're trying to turn the health service into a fee-for-service service for patients. Well, I've got news. It's already a fee-for-service for patients when a patient can't get simple surgery on the health service and has to dip into their life savings and clear out their life savings to have that operation in the private sector. Then they accuse the concept of change as one that might lead to asset stripping of components of the health service. Well, it's already being asset stripped because our biggest asset are our staff. And we're hemorrhaging staff at a rate that I've never seen before. And these are experienced members of staff that are not there to guide and to coach and to mentor juniors. And we are losing a generation of institutional memory that we haven't even begun to calculate what the effects of that are going to be, because those staff are really the DNA of the health service. And that's why, of course, we all agree in this room there's an urgency to elect a Labour government. But also, as progressives and as people that are intimately involved with the Labour Party, there's also an urgency to start putting meat in the bones of a policy offering, which I'm glad already has been happening under the guidance of Wes, as to what the NHS is going to look like under a Labour government and over the next 75 years. To my mind, I'm obviously hospital-based, and as already has been described, the health service is much more than hospital. It's hospital in some ways is only a microcosm of health and the health service. But optically, it is what the public view, it's the lens through which the public views the success of a health service. When there's ambulances parked up outside and they can't get in, we are judged on that as health workers, but also as a government. So for me, therefore, there's kind of three strategic strands, hospital-focused, because I don't have any, qualifications out with that. First one is, how do we stem the hemorrhage of staff? And we've got to see this in the global context, because there is a shortage of healthcare workers all over the world, and they can go anywhere, and unfortunately a lot of times they do go anywhere. And we have to work out how we can make the NHS a great place to work again. And it's no coincidence in my junior days, when there was a Labour government, I used to sometimes feel quite guilty about even taking a pay packet home because I was having so much fun at my work. Maybe that's just how sad I am, but yeah. But there's something in that. And we have some of the most highly qualified clinicians in the world in terms of their breadth of training, multiple degrees, PhDs, MDs, papers. We train them with modern medicine, we train them with higher order thinking, and then when they start working and they become consultants, we kind of funnel them into these narrow silos of micromanagement and being drowned under bureaucracy and administration, unable to unleash their potential and achieve that work satisfaction that they're all craving for. So I think we need to understand how to value their time better, not only financially, but in terms of a growth development for them personally. And for me, that's about fostering clinical leadership, giving people autonomy, but also then setting the boundaries by which we're going to judge them in terms of their activity. So probably not possibly valuing time and paying for their time, but starting to pay for their activity. And that's, I think, something we can develop together over the next few years. The second thing I think we need to do is reimagine the paradigm of patient safety. No one will ever disagree that patient safety inside an operating theatre or inside a ward is of paramount importance. But what also we need to understand is we can't just concentrate on the safety of patients inside the hospital. We have to concentrate on the patient safety of the patients that can't get inside the hospital because they're waiting 2 years for an operation, or they're waiting in an ambulance outside the hospital, or they're waiting inside their own homes and can't get through to a GP. You know, the concept of patient safety needs to be at a population level. And I think sometimes, you know, instead of it going hand in glove with efficiency and quality improvement, patient safety is often at loggerheads with that. And you come up against that time and time again, or we can't do that because it's a patient safety issue. So I think we do need to reimagine the concept of patient safety and reset that narrative. And thirdly, I think it's about a digital health revolution and unblocking, not only reducing the demand, but unblocking the demand for the front door. And that's where I think backlog management and our future strategic development of the health service really needs to go hand in hand. Because how we deal with the backlog should be a portent for how we see the future of the NHS as a sustainable organisation. And digital health has a big role to play. And I think this is where the Tories and the SNP in Scotland have abdicated, you know, their greatest responsibility. We're midway through the 21st century, and we haven't even scratched the surface of the potential of digital healthcare to improve outcomes and treatment and diagnosis for patients. We need to rethink about how that happens. Digital monitoring at home, hospital at home, remote monitoring, real-time monitoring. These are all ways to bring down pressures on the front door of the health service, and we need to embrace that. And in the ways that I've seen it work as a transplant surgeon, you know, we have transplant patients, you know, having access to their own blood results. It really makes them invest in their own healthcare. And some of the stuff we've spoken about already about health prevention, I think is intimately related as to how patients interact with their own health data. So I think there needs to be a lot more work around that. Because at the moment we have 21st century doctors and nurses, highly qualified, working in a 20th century system. And I think, you know, Labour is the natural party that's going to bring health technology to the fore as a way of solving this crisis. So I'll leave you with a little story, I think, which really tells you the best about the health service. So I had a patient referred to me with a liver cancer by an oncologist, and he was referred to me on a Thursday afternoon, and he was going away for a week, and he wasn't going to be back in time for things to get moving. So I saw him on a Friday evening, about 6 o'clock after my operating list, just brought him up to a clinic room, saw him. And I had a potential operating slot for him this coming Tuesday. But he still needed an MRI scan, other bits and pieces, assessments. And my secretary was still in, because she's always working late. And she got my email as I sent it. She phoned the patient. One of my junior doctors offered to help organise the scan, and within about 2.5 hours on a Friday evening, last Friday, we had an MRI scan booked for this coming Monday. We had an operating slot sorted for this coming Tuesday. We had pre-assessment, everything done. Now, all of that happened, unfortunately, not because of the health service, but in spite of it, because of people going the extra mile. But we all know that's possible for every patient, and we can create a service that makes it possible for every patient. And I think that's why you'll find key workers more and more coming to frontline politics, because they know what's possible, they know how it's deliverable, and they not only want to help shape policy, but they will also want to help deliver it. And that's why I'm here, and I hope I'm here as part of a Labour government next year, and as Wes Streeting as Health Secretary, hoping to deliver that change we all desperately need. Thank you very much.
Thank you. Thank you very much, Zubir. Wes, I think you've just found one of your new ministers, I think, Wes. Now,
I'm worried he's going to take my job.
Oh, God.
well, there you go. I think it was a very accomplished audition, I'm sure. Charlotte Augst.
That's great.
Just, can you hear me?
Loud and clear.
Okay, cool. Nice to be here today with you. As you said, I used to lead National Voices, which is a coalition of health and care charities until recently. And so I'm going to talk a little bit about the community and people perspective, really. The essay question you asked us to address was, what would a health service look like to be proud of? And I think one thing that's very striking when you talk to people about the NHS, and obviously I've done that loads, is that they're very proud of the values the NHS expresses. And I think it is a very clear expression, the creation of the NHS, of the fact that we all have the same dignity and that we're all equal and that we all deserve good care should we fall ill, no matter where we're from and what we do for a living and so on. So it's a very clearly enshrined set of values around our equal dignity, which people are really, really invested in. And I think we should take heart from that, because it sometimes seems politics right now is so tribal, is so nasty, that we can forget that people actually share these values very largely beyond party politics. They want to believe that the health system is there for them, no matter their income, no matter what they do for a living, no matter whether they brought the illness on themselves. And they really value that. But I think what you also hear, and what you obviously hear increasingly now, is that as a service we expect to deliver for us, it's not often doing the right thing for people. And people get very anxious about that. And I think that's something we need to all collectively really worry about, which is that there's a huge amount of anxiety now, both by people who are not currently ill and who just think of the NHS as a safety net that they need to be able to fall back on should they or their loved ones find themselves struggling with ill health or with an accident or whatever. And also people who have reason to use the health service and the care service in an ongoing way. So people who have passed the threshold towards chronic ill health also feel very anxious about the state of the health service. I had reason the last few days to hang out with some junior doctors and medical students, and it was really striking how all of them said they're not foreseeing to take a full-time career in the NHS. They think the NHS is too broken and as a system to tie their own lives as an employer to this. They were saying maybe a day a week, maybe 2 days a week they would work in the NHS. They're going to pursue portfolio careers. I don't know whether people planning for health and care have fully clocked that. The other thing I found really striking was what they said. They feel like they can't rely on the system themselves if they need health services, and that some of them were taking out private health insurance, which is something very rare for young people to do. And they were saying it's like the cost of a gym membership. If you're young and you're healthy, it's not actually very expensive to get private health insurance. And they think it's actually better for them to buy themselves the safety net of private health insurance rather than buy themselves a gym membership, which I think is just really scary when you think these are junior doctors, these are medical students who in the past we assumed were going to be proud of the service and want to spend their life giving their working time to this service. And I think what we have to worry about as people who care about the values I started talking about, the value of shared and equal dignity of all, is that it then feeds a sort of narrative that these are kind of good ideals, but in reality, you can't really make it work. And I think those are arguments that largely support the political right. You know, these are fancy ideas that we should all have good healthcare when we fall ill, whether we are rich or not. But really, when you look at it, it's all a bit shit, isn't it? And, you know, actually, we need a more hard-nosed approach to designing healthcare services. I think this is a very, very worrying narrative that we mustn't let settle. So what do people want? What would it look like for people to think that they have not just a system that enshrines good values, but a system that's actually designed well to deliver the services they need? And I think an important statistic to bear in mind here is that about 80% of people use about 20% of health services, and about 20% of people use about 80% of health services. So people have different interests when they think about the health service. Those of us who are normally well and just want the NHS as a safety net, we mostly worry about access. We want immediate access. And I think it's easy to dismiss that as a sort of luxury request, and it's not. We need that, like Joe said, for us to get on with our lives, for us to go and work, for us to raise families. We need to know that when we get ill, we can access health services. And I agree with what you've just said, that some of that will need to be digital, some of that will need to be remote, in and out, done. Those of us who've passed the threshold towards chronic ill health, and let's face it, that's a huge number of people, 50 million people in England, and as we get older, most of us will live on the other side of that boundary, will live with ongoing ill health, will live in the country of patients. We want something else. We want the system to coordinate itself around our needs. We want to be able to navigate this. And we come across this sometimes at younger ages when our older relatives tip into needing health and care services more, and we're bewildered. We just, how is this supposed to work? And what we experience is very fragmented, very wasteful, very ineffective healthcare. And we can't continue like that. We can't afford to continue like that. Now, health policy papers for the last 30 years have said we need to move care out of hospital, we need to get upstream, we need to do more prevention, we need to coordinate care better, we need to focus on access, we need to focus on navigation, and we're not doing these things. We're pulling more and more care into hospital settings, primary care and community care are more and more depleted, we're refusing to bite the bullet and invest properly in public health in the way Joe has very clearly outlined. And I think we need to ask ourselves why that is. And I think it raises question not about just the kind of things we say in a health policy paper, but about the delivery mechanisms for what we need to achieve by way of progressive ambitions. And I'm very heartened when I hear Keir and others in the party talk about the need to wrestle back control from Westminster, the need to take decisions closer to people, and the need to democratize services. To do that in places and to really go all the way down the devolution angle. And I think nowhere is this more needed than in health. And I am really worried that the health system will be in such a state by the time Labour get in, that there will be a temptation for Wes and his team to say this is in such a mess, we've got to wrestle back control, we've got to bring it back close to the ministerial table and run the health service from Westminster. And I just want to kind of guard against that and say this ain't going to work. Everything we've learned by now is that if we want the kind of preventative, health-creating, community-based, responsive health service we all want, we need to create that in communities, in places, in partnership, and these can only be created locally.
Well, thank you very much, Charlotte. You threw that to Wes there, so I want to bring Wes in and make some time for some questions as well. Plenty for you to think about, Wes, in those three very detailed contributions from our expert panel. What is the answer?
Well, I'm just crossing out the bit that said centralised control under my direct authority after Charlotte's speech. And it's great to be here and great to be joined by such a fantastic panel. And Zubir's right, it's absolutely outrageous that he's here today rather than knocking on doors in his constituency. And the only way in which we can undo this damage is for all of us to book train tickets to Glasgow and go and campaign for him. So having done that already once, and I'll be back, I urge all of you to do the same. Look, we are, in a few matter of weeks, we're going to be celebrating the 75th anniversary of the founding of the National Health Service, and what a state it is in, because it is in objectively the worst crisis in its history. And 75 years ago, the founders of the National Health Service, that pioneering, reforming Labour government, arrived on a central founding principle, a unique founding promise that everyone wherever they live, whatever they earn, should get healthcare that is free at the point of use. And the last Labour government built on that promise by instilling a second one, that the NHS would always be there for us when we needed it. And after 13 years of Conservative governments, and despite a golden inheritance of the shortest waiting times and the highest patient satisfaction in history, that first promise of an NHS that's free at the point of use is under threat, and that second promise of an NHS that is there for us when we need it is already broken. The last Labour government didn't tolerate long waits for care, and the next Labour government won't either. And it is, I think, a monument to Conservative failure that they have become the norm, and that the NHS now faces both an unprecedented immediate crisis, but also an existential long-term challenge. The immediate crisis is very obvious. It's month-long waits to see a GP, ambulances that can't get to people in time to save their lives, in some cases heart attack and stroke victims waiting an hour when we know every second counts. 24 hours in A&E, not just a reality TV programme, but the lived reality for too many patients. And more than 7 million people on NHS waiting lists itself, an unprecedented number. And the Conservatives want to pin this on COVID-19. It is a core part of their script. Oh, but the pandemic, didn't you know there was a pandemic on? Well, of course, the COVID-19 put the NHS under strain and continues to do so. But we went into the pandemic with NHS waiting lists already at record levels, went into the pandemic with a workforce crisis in health and social care, and we went into the pandemic with an NHS that was unprepared and dangerously disarmed for the crisis that it faced and the crisis that confronts the country today. And it's because of this immediate crisis that the health system now faces an existential long-term challenge. As Zubir alluded to, it's becoming a two-tier system, with an creaking NHS care there for those who can't afford to pay, and timely care offered to those who can afford to pay to go private. And as we've heard, many people on the right have always believed that the NHS's founding promise was never sustainable or desirable. They didn't believe in an NHS that was free at the point of use when it was founded, and they will use the state of the current crisis to say it's not the government that's the problem, it's the model. It's the NHS itself. It's not sustainable in the 21st century. And they will play into a deep cynicism and despair amongst the voters that things can't get better, they only get worse, as Keir talked about in his opening remarks. But whenever the right have held that view, they've been at odds with the public. The danger is that we reach a tipping point where people decide the NHS can only be there for people who are hard up, and that reluctantly, begrudgingly, we just have to accept that people will have to pay if they've got the means to do so. And we've also got a challenge where some people on the left believe that problems within the NHS can only be solved by more spending alone. And some are afraid to confront the failings in the health service for fear that people might mistake reformers for efforts to undermine the founding principle of the NHS. And goodness me, if I had £1 for every tweet I get from the left on a daily basis telling me we want to privatise the NHS, I could personally fund the NHS. Sadly, that's not going to be the answer. And look, I've been very clear about where I stand as someone who went through kidney cancer just 2 years ago, and where the only thing I never had to worry about was a bill. We will have a paid-for NHS in this country over my dead body, and we will have a privatised NHS in this country over my dead body. But the reform argument I would make is this: even if the NHS weren't in the worst crisis in its history, which it is, it would need to change. And even if the public finances were in an absolute state caused by the Tories, which they are, money wouldn't be the only answer. We've got to change the NHS so that it's able to meet the challenges of the future. That means change so that care is taken from hospitals into the community, fixing the front door to the NHS, modern community health centres providing a range of services, mental health community hubs which would deliver faster access to mental health support for patients, but also also alleviate pressure on our poor general practitioners who are completely burned out and overwhelmed. Pop-up health centres for women's health so that women aren't waiting 7.5 years for a diagnosis for a common condition like endometriosis. Bringing back the family doctor with incentives for continuity of care so that people with ongoing conditions get to see the same doctor and don't have to explain their history over and over and over again. And an NHS that's as much about the neighbourhood as the national, and a neighbourhood health service underpinned by district nurses and health visitors, a core part of our workforce plan, so that in the community and in the comfort of people's homes they can receive the support not just when they need it, but where they need it too. We also need to change so that we have the workforce we need with the equipment to deliver the biggest expansion of NHS staff in history. That's what we've promised, funded by the non-dom tax status. Rishi Sunak knows all about how that works. And I'm sure the government is going to nick that before the summer in their workforce plan. And imitation is the highest form of flattery, and I'd quite like a head start on recruiting the doctors and nurses we would need. But we also need to harness the enormous potential of life sciences and technology. As we've heard, we are sitting on top of an exciting revolution where AI interpretation of chest x-rays can save 15% of radiologists' workload and also huge costs in delivering faster diagnosis for patients, speeding up care. Genomic medicine means that not only can we diagnose faster and get better outcomes in treatment, we will be able to predict and prevent disease before it even takes place. This is a revolutionary game changer, and it's being discovered, the breakthroughs are happening here in Britain, but we need a government to back those discoveries and see more of them and make sure it's adopted and rolled out more effectively across the NHS. And finally, change so that we focus on prevention. Because Keir has been very clear with me, I'm not going to be the Secretary of State for the NHS or even the Secretary of State simply for the Department of Health and the NHS and the social care system. It will be my job to be the Secretary of State for Health who takes the issues of secure jobs, fair pay, adequate housing, safe streets, clean air, accessible transport, affordable, timely access to and facilities for exercise, nutritious food, all of the underpinnings of good public health so that people, wherever they live and whatever their background, can lead healthy, good lives, actively participating. And there is no route to building that fair and just society, that healthier society, that does not involve pursuing Labour's historic mission to eradicate poverty in our country. It is possible in this, despite the Tories' best efforts, one of the richest economies and societies in the world, to narrow the gap in poverty and life chances between rich and poor. And it is an absolute disgrace that under the Conservatives the gap has widened. But it will be our job, our collective mission, to be going after the poverty, the inequality and injustices that breed ill health. Make no mistake about how ambitious that agenda is, how long it will take to deliver. That's why the 10-year missions are absolutely the right focus, and be under no illusion about how radical that change will be if we get permission to bring it about. And that is why what we saw last Thursday and what we saw on display this morning is a remarkable turnaround from our worst defeat since 1935. And imagine how we will feel, particularly the people in this room who were here in this room in the hard times. Imagine how we will feel when we can collectively say we were part of a generation that did what people thought was impossible, to take Labour back from its worst defeat from 1935 in a single term, having changed the Labour Party so that we can change Britain, rescue the NHS from the worst crisis in its history, build a social care system, a national care service worthy of the name, and give to future generations what the 1945 team gave to ours. How amazing would that be? That's the possibility and hope in front of us. We now need to persuade the country.
Well, thank you very much indeed, Wes. I think they might like you. We're going to take some questions now. We do have a hard stop of 12:35. So can I just make an early plea and a firm plea for questions, not speeches? If you do speak for longer than 30 seconds, I will append a question mark forcibly to whatever you've just said and put it to the panel. So I'm going to try and take as many as we can. Do keep your hands up so the crack team with the roving mics can find you. Can we take them in threes? This gentleman here, this lady here, and the lady at the back as well.
Thank you. Really inspirational, actually, hearing from all the speakers, especially Wes there. My name is Leonie Cooper. I'm one of the London Assembly members. People mentioned preventative and monitoring, self-prevention, self-monitoring. But I wondered if you could, and the impact on hospitals that improvements there will have. Could you say a bit more, Wes, about the blockages created in hospitals by the appalling state of the care sector and the inability for people to leave hospital and people living in sometimes really quite squalid circumstances because domiciliary care and home care is in such a state. Thank you.
Thank you. This lady at the front here.
Hi, I'm Christabel Cooper. I completely agree with the points about prevention. But given that preventative healthcare is going to take years to yield results, how do we bring people along with that agenda when hospitals are falling apart as we speak?
Thank you, Wes. Peter Patashka, I live here in Camden. I run my own business, but I'm also here with my husband that works tirelessly in the NHS, as so many people do. You talk rightly about workforce reform. I think that's a key part of this, but also technology, AI. How, given the public purse is where it is, how do we make the best possible use of technology to reform our NHS?
Thank you very much. I'm aware most of those questions were directed to you, Wes, but Zubir, if we start with you on the question about blockages and social care, what do you think? What is the solution there, if indeed one exists?
Well, yeah, I mean, it's the single biggest kind of inhibitor to discharge, and we do need to integrate it. There are many different models we can use. Public funding will need to be an element of that, but this is another place where digital monitoring can really come into its own. You can have hospital at home. That concept can develop. You can get people out that need a bit of extra monitoring, as long as there is a backup and support there, and for them to be treated if there's any deterioration while they're not in the hospital. There are many situations where we can even discharge post-operative patients a lot faster if we have that digital infrastructure for monitoring. A lot of the times where patients and their doctors just need that comfort to know that someone's just keeping an eye on their various physiological parameters. And I think investing in that actually will yield the biggest results in unblocking.
Christabel and Peter, Wes, I think you can take both their questions in turn because it's about prevention but also the use of tech and AI. Are you thinking across the piece on that tech and AI are part of the prevention agenda?
But yeah, very much so, and there's a sort of total alignment between my thinking on health and social care and Johnny Reynolds' thinking about Labour's industrial strategy and emphasis on life sciences, and Rachel's thinking about how we buy, make and sell more in Britain, and make sure that so much of those breakthroughs and advances and manufacturing takes place here. And so, we are sort of joined up as a team, which is going to be really important when I talk about the capital transformation needs of the NHS, and go and see Pat McFadden, who, those of you who know Pat will know, if you say spending 3 times, he apparates with a scythe. Because there are tough choices, but I think that on technology and AI in particular, whether it's new treatments or technology, there are big wins here for patients, for staff and for taxpayers. Some of it is really exciting in terms of the new medicines that are coming on track and the way that we can reverse conditions that we previously thought were irreversible in terms of healthcare. I mean, that's game-changing stuff. But, this is less exciting. But in terms of the productivity of the NHS workforce and making people's lives at work happier, just dealing with some of the really awful dead hand of bureaucracy in the back office would also make a big difference. And, no one's going to go into the election and say, what do we want? Greater back office efficiency. When do we want it? As soon as humanly possible. But it could actually deliver really big changes. And the final thing I'd just say on social care, bit like the NHS, the one thing we have to do over and above everything else is fix the workforce challenge, because we are failing to recruit and retain the staff that we need. And without the people, we don't have a service, and it's a disaster. And that's why we are spending so much money for people being in hospital longer than they need to be, when that money would be better spent giving them the great social care that they deserve.
I want to take another round of questions in, but Joe and Charlotte, if you wanted to just chip in briefly on that question, Joe?
Yeah, I think having heard all the speakers now, I mean, I'd kind of challenge back a bit. I think we shouldn't see the NHS as a kind of end in itself. The NHS was there, it was set up as a sort of backstop for us for when we're ill. It was never meant to go it alone. And I think if we think about prevention as just being about helping the NHS, that's the wrong way round. Prevention is to keep people healthy in the first place so they can be productive, be work, create a strong economy and have good lives. And if we have that, we actually start to generate the public finances we need to invest in services. So we
Absolutely
really have
right.
to look at this the other way round.
And if I might just very briefly add to that sort of argument about prevention, you know, we think of social care as a preventative service, and rightly so, but social care itself doesn't just prop up the NHS, but is propped up by informal carers, for example. And informal carers are propped up by friends and relatives and neighbours who are leaning in and supporting these efforts to keep people well and to keep them in the community. And I think I'm always a little bit worried when we think about prevention as some shiny tech app. It might have a role to play, but prevention really often is stronger community connection and people having hope and purpose in communities and supporting each other, and therefore, without thinking about the healthcare system, holding a lot of healthcare need that otherwise just flushes into the system in an unplanned way. And we just need to bite the bullet and say we need to invest in communities so that they can be healthy, so that they use health services in a more plannable way.
Wes, what would you say to those 2 points?
Yeah, I completely agree. And just on, on this thing about the NHS, I mean, this is why I said look, it's a service, not a shrine. It's really important that, we're honest about its failures and also clear about its purpose. During the pandemic, I thought one of the mistakes that was made in the messaging, and I understand why the choice was made, but this sort of, stay at home, protect the NHS. No, the NHS is there to protect us, not the other way around. We needed to stay at home to protect each other, and most people in this country followed the rules. That's not what it was about, actually. And I think the people who work in the NHS know that, but it's why also sometimes I do come across producer interests, vested interests, who almost by accident lose sight of the fundamental focus, which is about the patient and what's right in terms of the public interest. And that's how we've got to design services around the patient's interests, not around producers' interests.
Right. I'll take one more question, and this is an invidious task, picking one person. Whoever you're nearest to with the mic, Dylan.
Oh, that's such a cop-out. A cop-out.
Lucky me. Tom at Labour List. I just wondered for Labour supporters, what would you say if you had to do it in one line? What's the kind of key message on the NHS that supporters can take to the doorstep?
Well, let's take that in turn. Joe, if you were advising Labour, what would that one line be?
It has to be invest in prevention and keep people healthy in the first place.
Charlotte?
Health is more than biology, and we need to have healthy communities with everything that means, and the NHS has a role to play in that, but it's not the only player.
Zubir?
I would say patient-centred, clinician-delivered, and I'll just want to end on a positive note, because I think the NHS has such a depth of professionalism and intellect. It's going through a hard time right now, but if we turn this around, it can be a beacon again, and it can be something we can actually monetize and show the world how to do it right, and they'll be coming to us to ask us, like they used to 20 years ago, how to get their health service systems back up and running.
Wes, what's your one killer line?
Cut waiting lists and waiting times. We did it before, we will do it again, and it will be the record of investment and reform that will deliver the NHS there for you when you need it. And I'll just add one caveat, by the way, which is on prevention, in case anyone gets deeply disappointed. I'd spend lots of time talking to undecided voters, as the Labour Party does. I'm afraid it's waiting lists and waiting times that will win their hearts and their votes at the election, prevention and health inequalities, it kind of just, people don't see that as a priority or always the role of government. The reassurance I can give you is we're going to do that anyway, because we know how important that really is.
Well, thank you, Wes, and thank you to the rest of the panel.